How do medications affect H. pylori test results? Imagine trying to find a tiny bacteria hiding in your stomach, but your medications are making it harder to see. That's exactly what can happen when testing for Helicobacter pylori, the bacteria linked to ulcers and peptic ulcer disease. The most common test used is the urea breath test, which detects the bacteria's urease enzyme. But certain medicines can interfere with this process and lead to inaccurate results. Proton pump inhibitors are drugs like omeprazole, lansoprazole, and esomeprazole. They work by reducing stomach acid, but they also suppress the activity of H. pylori bacteria. This decrease in bacterial activity means less urease enzyme is produced, which can cause the urea breath test to show a false negative. Essentially, the test might say you don't have the bacteria when you actually do. To avoid this, health professionals recommend stopping proton pump inhibitors at least 14 days before testing. H2 receptor antagonists, such as famotidine and ranitidine, also lower stomach acid but tend to have less impact on the test. Some, like roxetidine, might cause occasional false negatives, but generally, famotidine does not interfere much. Still, it's best to stop these medications at least 24 hours before testing to ensure accurate results. Antibiotics and medications containing bismuth are another concern. They can temporarily suppress or eradicate H. pylori, leading to false negatives if taken too close to the test. To prevent this, they should be discontinued at least 14 days before testing. This pause allows any bacteria to return to normal levels, giving a clearer picture of infection status. Antacids like Tums or Maalox do not significantly affect the urea breath test. You can usually take them up to the day of your test, but it's wise to avoid taking them right before to prevent any potential interference. In summary, to get the most accurate results, it's important to stop proton pump inhibitors and antibiotics at least 2 weeks before testing. H2 receptor antagonists should be paused at least 24 hours prior. Antacids can typically be continued but should be avoided shortly before the test. If testing occurs while these medications are still in use, false negatives may happen, which could delay diagnosis and treatment. In such cases, your healthcare provider might recommend repeating the test after stopping medications. Alternatively, stool antigen tests can be used and are less affected by some medicines, but they are best performed after medication withdrawal too. Always follow your doctor's advice and discuss your medication schedule before testing to ensure the most accurate results.